put it on our website, that's what I had
See, if you would have done the job,
You can tell I'm not no secretary, that's for sure.
West Lebanon. there's
See,
no
that's why I
problem.
said to you, when you become a psychiatrist, I'm your
I'm gonna
secretary.
become a shrimp.
Please send anybody that arrives in here, please. All right, good afternoon, everyone. Thank you for coming to our education program on back safety and body mechanics. With the idea that you will leave here with a better understanding of how to take care of yourself when you're making transfers or you're helping somebody to move around and get out of a chair or get out of bed or even get into bed. Today we have with us Gina from PT 360, which is a local physical therapy firm. And Gina has graciously agreed to help us cover the topic. I gave her some guidelines as to the things that I wanted to try to cover, and the handout that you've got in front of you, back injury prevention, most of the content in there Gina will attempt to address. She's going to give us some demonstration and maybe work with each of us a little bit to practice some of these things. And then there'll be a small post-test at the end, which I'll ask you to complete before we leave. So I can have record of the fact that you were here, and then I'll give you credit for it as a TLC employee. It'll go in your file. The only other thing I'd like to add is I'm hoping purposefully that this program will prevent any one of you from becoming a workman's compensation case for TLC, and also prevent you from putting yourself in a situation where you can't work. Because looking around the room, I know the people that are here, and I know you all like to be doing the work you're doing. Okay? Because I know you well enough to know that. So with that said, I'm going to give Gina the floor and let her take over and take us where you need to.
Okay, perfect. So I brought some handouts too because I've taught this class a bunch of times and I have a general format that I use just to keep myself on task, because something that typically may take me a half hour to present could take me 2 hours if I get to talking. So these are,
Oh, the packets?
they're little packets.
Little packets. Go around.
There you
Okay,
go.
Very good.
And so that's why it says tonight I'm going to, because usually it's an evening class.
Take a packet, pass it.
And then I do have some general exercise pictures for stretching and strengthening. That might be something that we kind of review at the end,
Yeah, very good.
so we can review that a little later.
Okay.
So again, today I'm going to review some tips. Can I look at the camera?
No, necessarily. Be yourself.
All right.
Feel free to just move about as you need to.
Okay, so today I'm just going to give you some general tips on how to stand, move your body, and just really decrease, again, your chance of injury to you and to your clientele. So, healthcare providers, this is in your back injury prevention. Again, I'm going to try to address most of this stuff. But healthcare providers suffer one of the highest rates of back injuries, second only to construction workers. Which is, yeah, it's a big deal. As you all know, we're all put in awkward positions daily and often repeatedly. You know, we get into someone's home and it's a small space, or we're trying to transfer them to the toilet or out of bed, but the bed can only be on this wall because it's the only place it fits. And so often awkward positions repeatedly, and really having to exert ourselves because maybe it's just us in there and the person doesn't feel well and they require greater assist that day. So again, everything that I say is something you should remember for later on. We often have issues, again, like I had said, we're lifting someone and we should have help, but maybe they haven't been reassessed in a while. So that's something you want to bring to the attention, you know, of whoever your direct supervisor is too. I know that, I'm not sure how TLC works it, but oftentimes someone will be assessed and you go in and they're functioning very well and maybe they're a moderate, you know, a min-mod assist. And then the next day you go in and you're max assist just to drag them into the chair, really. And so we're going to review all of that today and really, again, how to safely move them. You know, other things that lead to these injuries are double shifts. Things like this, where you're having, you know, you're like, oh yeah, you know, I could use a little bit extra, it's the holiday season, oh, you know, or, you know, I really like this client and I really want to be there for them, because you start to form relationships with them. And so you just put that little bit extra out there for them repeatedly, and you know, that sort of thing really does lead to an increase in instance of injury. You know, the other thing, again, people that aren't in good physical condition. So, you know, you're really tight. Maybe years ago you were a lacrosse player or something, who knows? You know, maybe you were a cheerleader and you have all these old things that, you know, you have some aches and pains or whatever, and then those often get exacerbated again by these increased physical demands. And so it's really important to make sure you're staying stretched and you're staying strong. And it doesn't have to be that you're in the gym an hour a day. But I did print out some basic stretching and core stabilization things just for you to be able to look at later. Yeah, for you guys, yeah. So here, just leave it one so I remember what I put on there.
That's gonna be us too.
And that's what we can review a little later too. So to my little cheat sheet, which is the page that says, tonight I'm going to, the body mechanics sheet, general rules of lifting. We're going to review that. So you want to never lift more than you can comfortably handle. Always keep a wide base of support. They say 8 to 12 inches, but standard shoulder width is a good guideline. In your little handout, it just says, or in the back injury prevention, it just says shoulder width, but I often do a little bit of a staggered stance too, one foot a little in front of the other, and often that helps you with controlling your knees. And we're going to review, you know, your knee position a little later on. And use your legs. Always use your legs in lifting. So tips for moving. You always want to plan the move and know what you can and cannot do. So knowing your limits, that's very important, knowing your limits. So you go to the client, you just get there, you go in and you need to get them up for the day. And you realize maybe they tell you they didn't sleep well, or, you know, I mean, depending on how sickly they are, you might get in there and maybe they'll have a flaccid limb that they didn't have previous. So you go, you assess them, and you say, you know, at this point you decide, maybe I need a draw sheet, maybe I need a slide board, maybe I need a trapeze bar, Hoyer lift. What is going to be the safest mode of transferring this patient today? And again, you know, I'm not sure how frequently the assessments are done, their mobility assessments, but, you know, it might be one day they're contact guard and the next day they're in mod. And so, again, it's going to be day to day. And those pieces of equipment are important to have access to.
So you're aware, we do have some caregivers that use Hoyer lifts.
Yep.
We have some caregivers who use gait belts as needed. We routinely have clients walking with walkers.
Yep.
Sometimes they're rolling, sometimes they're standard. And occasionally, we have the good fortune of having a client who has an electric hospital bed, or at least a mechanical bed of some sort. And some others have occasional rising recliner chairs that help them to rise and sit. But again, as a rule, I think we rely more on our body to make the transfers and to do the movement than we do on machine.
Right. So other tips. So again, assess the situation and how you feel like they're going to do today. So another tip. Let the person do as much as they're capable of, because as much as we want to be there to help them, we also want to help them be as independent as they can for as long as they can. And that's my physical therapy pitch, because, you know, oftentimes these riser chairs are easier for people to get up, but then if maybe they didn't necessarily need it and then they're in it for 3 months, then maybe they can't stand up out of a regular chair. And so it's really important to let people do as much as they're capable of. Don't let them put their arms around your neck. That is terrible. If they're going to hold on to you in some way, I would say just let them contact your waist. Never around your neck. Contact maybe the outside of your arm, but never hugging around your neck. Use a gait belt as often as possible. Transfer belts, I'm not sure who has them, who doesn't, but it really is a nice way to keep you and your client safe. We're going to review these and safe use of them a little later. You want to always place transfer surfaces close together. So if you have a wheelchair to a bed, you want to make sure it's right up tight next to the bed. Also another tip, you know, head of bed is usually easiest, but one of the other things is make sure you're transferring clients to their strong side, especially if they, you know, if they have maybe a history of a stroke or something where they have flaccid limb. It's much easier to transfer them to a strong side. Always avoid sudden movements. Never pull on the person's arms or shoulders. I know a lot of times, especially in a rehab setting, you will see some people try to hurry and grab them under their shoulders and move them over. That is terrible. If they fall, then you're dislocating a shoulder. So they're not safe at that point. Be sure that the person's wearing appropriate footwear, so maybe it takes a little bit longer to put on a sneaker or a non-skid sock, but that's going to keep, again, you and them safe. You're going to have less instance of fall. Limit your twisting. Again, you know, if you're in these awkward situations where you're in a tiny, tiny bathroom and with a wheelchair and grab bars, it may be inevitable, but you want to limit your twisting. You want to pivot, step, turn, pivot as often as possible. Engage your abdominals. Engaging your core protects your back. We have these lovely muscles called transverse abdominals, and they wrap around and they act like a natural lumbar support for you. So that's a muscle group that I printed a couple of exercises for that we can look at. Short lever arms. Make sure you get those people in as close as you can. And they're going to be easier to handle and lighter in here than they are out here. Smooth movements, nothing herky-jerky, and again, try to avoid awkward positions if possible. So, you know, maybe they have a difficult leg rest that loves to get stuck and you'd rather not have to move it out of the way, but if you can move it out of the way, you're not going to trip over it, nor are they. And then, you know, like I already said, rule of thumb, transfer to the strong side. Okay, so gait belt placement. This is tough because depending on how long they've been in the wheelchair and how fit they are and such, they might not have the perfect waist to put this around, okay? So we're going above or below. They might have feeding tubes. Those are things you have to be aware of. Central lines, things like
Ostomy bags.
yeah, colostomy bags, all of that. So the gait belt. You want it as snug as possible. They're going to tell you it's too tight. But you know, when you stand up, it loosens because things move. So, I'm not a big fan of plastic belts, by the way. It's just the only one we had at the clinic.
You know, like the metal belt?
Metal belts, yeah,
metal
because these
buckle.
plastic clips are very easily broken in the event of a fall.
Did you already start?
Come in, Sylvia, it's
Yeah,
fine.
come on. I thought it was at 4:30.
We just began, come on in.
All right. So, around the waist if you can. If not, I tend to try to go below the belly. Last resort would be above the belly and under the breastbone, because you never want it to end up here, never. So,
What about around the hips?
yeah, so underneath the belly
Right.
on
so-
someone with
okay, around the hips.
yep, that would be fine. So,
Do you ever place the gait belt under the buttocks? Behind the buttocks here, in this area right here?
I have not. That does not mean it's not something you
Would
can.
it be, I guess I've seen it done helping people off the floor
Right?
when they're really down low and they're
Yeah.
having trouble getting up, that's a way to bring them upward and have something like leverage to hold on
Yeah.
to, like you're doing when you're moving an appliance with
Yeah.
a strap.
Yeah.
Kind of thing.
I've never used it that way,
Never
but
done.
it might, I mean, I can certainly look into it and let you know whether they're saying something like that's safe, if you want me to look into
Yeah,
it.
well, I guess as a gait belt, you wouldn't be able to clip it. I
Right.
mean, that's the thing, you'd have to use it more like an under strap.
Right.
You're just using it to pull them upward. And they're
Just-
actually helping you with their body.
Yeah, as they're
If they
doing
can't
it.
lift themselves completely alone,
Exactly.
it's probably not gonna be very beneficial. So
Exactly.
forget my question.
So that's okay. So gait belt on. Important things to remember again about the gait belt. You're not trying to catch your client when they're falling. You're not, you know, out here and they start to fall and you're reeling them in like a fish. You don't want to try to catch them. But if possible, you want to slowly lower them to the floor or, you know, to the safest surface. You know, protecting yourself in the process. And then the other thing, always be aware of where their head is as they're going down.
Yeah.
So maybe you can't catch them with their gate belt, but you can maybe follow where their head goes or get your hand in the way of their head before it hits something. That's what you need to do. Gate belts. When you're assisting someone, if it's walking, I mean, this is not, if you're walking someone, always stay about a half step behind, 1 foot behind them, hand middle of the back, reaching underneath the gate belt. Beautiful. Thank you very much.
I'll be a body.
Oh,
A
let me
big
come
bo-
around.
A big
Let
body.
me come around.
No.
You're not quite my size.
No, it's not.
We'll borrow my pants today. So the metal ones too, they're easier to tighten when they're on because you pull them through here and then
Teeth
drag
grab,
that back.
yeah.
So when you're walking someone, I'll do this side just because it's easier for the camera, but when you're walking someone about a half step behind and hand up, because if you're here, then they fall, they're going down.
Right,
So
so
I-
your hand should be pointing, your
Yeah,
fingertips
fingers
pointing
up.
upward.
Yep. That way, if he lost his balance, I could correct that.
Right.
So I can correct that and pull him into me, but you have a wider base of support here too, so you can control that. You know, if you were just off over here, then you're not gonna control him. So a nice kind of wide base when you're walking someone, hand up through the gate belt. If he starts to lose his balance here, you correct him, he's still going down, you put one knee here and you pull him back into you. You pull him back into you and then you can slowly lower him to the floor. You're not trying to, oh, he's going that way. You're gonna do what you can to slow it.
Yeah.
But you're not gonna stop it, so don't try. At that point, you come around in front and just, you know, like I said, try to do what you can to protect his head, but you're not gonna catch him. You're just gonna hurt yourself and maybe him in the process.
But it's better to do the assisted fall than it is to try to stop the fall fully or
Yeah.
try to correct the fall.
Because then you're twisting and you're jerking. and-
Exactly. The other thing, you know, depending if you're in their home most times, you might be in a situation where you're in a hallway and you can maybe even push them up against the wall.
Yeah.
If you can't correct it, push him up against the wall and then he's slowly going down.
So
All right.
would you be walking at them on their weak side?
What are they walking with? If they have a cane versus walker, I always I guard on my right because my right is my strong side. Because I know that I can control them this way better than I can control them this way. But it depends on how much assistance they need. So if they're post-stroke and they're having a hard time holding the walker with their right hand or versus, you know, left hand, say it's a left hand, I then come around and hold them on this side and guide the walker and hold their hand on the walker on the left side. So really, comfort level and patience level makes a huge difference. If they tend to give out one side more than the other, I would, yes, tend to steer near that side. If their right knee gives out, I know that they're gonna tend to go right, so I would step that direction. Yep, excellent question. So any more
You're
questions?
faced with that right now, right, Melissa? Yeah. The client there, she and Zoraida work with, you know, is a mobility client. He has
Okay.
some mobility issues, so.
He
Yeah.
has a Hemi walker
He
Yeah.
has a Hemi walker.
now.
Oh. Hemi walkers, those are a whole nother ballgame.
What is a
Hemi
Yes, there is.
A Hemi walker is like a walker. It looks almost like an A-frame.
Yeah,
Yeah, and so it's a little clunky,
yeah.
but it's more stable than a cane.
Yes.
Yeah. Not quite as stable and not even close to as stable as a walker. But if they've had maybe a recent stroke and they've got, you know, this arm in a sling and this foot's kind of dragging along, it's easier to use the Hemi walker.
So it's like a three-prong thing, right?
Uh,
Yeah.
four.
It's a four-prong post.
Yeah, it
Okay.
looks like
Yeah.
like an A-frame. Yeah.
Okay.
All right. So,
Is a Hemi the brand name, or is it actually called
Hemi just meaning that it's one side.
a? Okay.
Yeah, it's used on one side. All right, so I think that covers everything from just a regular basic knowledge of the injury prevention.
What about?
And now we're gonna review the actual transfers.
Yeah, I was gonna ask you if you could speak a little bit to the bed mobility as a prevention strategy too.
Yes, so that's where
How
we're
to prevent
going.
injury, oh, that's where you're
Yes,
going?
that's where we're
Okay.
going with this, so we're going bed mobility, then to chair and.
Very good.
And
Okay.
beyond.
Excellent. Thank
So, bed mobility. The injury prevention sheet, tells you to go ahead and cross their legs, cross their arms, put one knee up on the bed, and roll them towards you. I agree. If you can, you want to keep their leg, this is a little different than here. The leg that is away from you, if you can bend their knee and it'll stay there, that's a nice way to roll them too. It gives you, because you want to hinge on their shoulder and their hip, so you've got one knee on the bed. You want it at thigh height, maybe a little bit lower than where this table is. Hinging on their shoulder and their hip and pull them towards you. Always towards you. Away, you can land them on the floor, and you don't want that. So let me just make sure I touch base on all this. So that piece. So always rolling towards you. Leg closest straight, we did all that. So, okay. Now we want to get into a little bit of the cognitive things. So with bed mobility and transfer mobility, you're always going to want to make sure you're communicating your goal with the clients. You want to let them know we are rolling to the right side. We are rolling to, and maybe not even the right side or the left, but roll toward me. It's often easier. Also, depending on their cognitive ability, the less words, the better. So that's going to be important. Not bend your knee, do this, do that, you know, roll towards me. The other thing is, again, always letting them do as much as they can on their own. So if there's a bed rail and they can use their, leg that's away from you, they can bend their, so say they're rolling toward the right, they bend their left knee, they reach to the bed rail and they pull with their arm and push with their leg and pull themselves over onto their side. Again, maintaining their mobility and decreasing your chance of injury. So always communicating your goal, be aware of limp limbs, that's part of, I believe, what they're getting at with this sheet, with the crossing their arms, crossing their legs, that way you know where everything is. Also, things to be aware of, any of that other equipment, the colostomy bag, the catheter, the
Feeding.
possible IVs, the feeding tubes, whatever else might be there. We already went over all that. So sitting from lying down. So sitting from lying down, you want to make sure that, is that one of the things on the injury prevention? If it's not, then that's okay, we're going to do it anyway, because I like to plan it through the process, bed to sitting to chair. So rolling them onto their side. As they're on their side, you want to place one hand under their shoulder, one at their knee. So here they are on the side, you are squatting. So they're already up on their side, hands where you can see them. One hand underneath their shoulder, one here between hip and knee. Bring them up. Again, nice wide base so you're not hurting yourself. Whether that bed raises or lowers, that's really going to be great, because then you're not having to squat so low or be awkwardly high. So you pivot them up there. If they can help you, top arm can push, bottom arm can push, whatever. But what you don't want them to do is still be holding on to this rail for dear life as you're trying to sit them up, which is always what happens if you're not aware. Again, always letting them know what you're doing, because it's easier to be like, okay, we need to be here at such and such a time, or we need to be at this process of our day at such and such a time, and I'm gonna get them up. So you do all your stuff, you sit them up on the edge of the bed, you transfer them to the chair, and they're in a whirlwind and they don't know what just happened. So it's very important to communicate all of this. All right, so they're up in there, or they're sitting up on the edge of the bed. Be aware again of what they're able to do. A lot of people can't sit there unsupported. So And before you sat them up on the edge of the bed, make sure you got your equipment all set. You wanna make sure that you've cleared all the clutter out of the way. You wanna make sure again that the wheelchair is likely at the top of the bed. It's a little bit easier there, but again on the strong side. You wanna make sure that the footrests are off and out of the way. You wanna make sure that the brakes are on. Again, that you've put their shoes on before you sat them up, because you don't wanna get them there and then have to lay them back down. So at that point, you grab your transfer belt, which you brought along somewhere, maybe you're wearing it, whatever, you put that on them. Keep them right to the edge. Check to make sure their feet are flat on the floor. You want their feet, this is kind of important, sorry I didn't paint my toenails for this, but you want to make sure that their feet are flat on the floor and underneath their knees. You don't want them too far back, but you want it to be where they can bear weight through them as they're leaning forward. You don't want their feet, yeah, they're flat, but they're out there, they're going to weigh more to you this way. So, you're here, gate belt on them. Make sure they're leaning forward. Again, talking them through all of this is very important.
You want to use me as a demo?
Yes, please, that would be great. Put your gate belt back on.
Yep.
All right, so, Alan, we're going to transfer to your chair. So oftentimes I would say, all right, Alan, we're getting in the chair. We're not going to talk it through too much. I'll give them step-by-step command as we go. Oftentimes, the more steps, the more difficult, depending on the cognitive impairment. All right, so keep your feet flat on the floor. Come to the front of your chair. So wiggle, scoot forward, Alan, scoot forward. There you go, that's far enough. Okay, so going to the bed or to the chair is going to be the same. It doesn't really matter. But what you want to try to do, with a gate belt, it's not as important as with a slide board, but you want to make sure that it's a slight downward slope. Okay? This is where I had a little bit of an issue with the handout that we have here, because it says adjust the bed to its lowest height. That's not always going to be the case, because if you put it at its lowest height and it's on wheels, there it goes, and you can't lift from that low. So you want it to be a safe position for you, a good height for you, which may not be the same height for Alan or for me or whatever. With the gate belt, again, it doesn't really matter the position of the bed to the wheelchair as far as height goes, but for the slide board transfers, it is going to make a difference. You're going to want them to be transferring downhill, never transferring uphill. All right, so I'm going to transfer Alan over here. Do you want me to actually do the transfer?
Sure, of course.
We're going to assume there are brakes on these chairs, okay?
I can stand there and be the brake.
Okay.
Yeah, why don't you do that? Yeah, because that might be something you would have to do actually in somebody's home, because you may not have a chair that's gonna have brakes on it.
Right. So Alan I've asked him to move to the front of the chair. His feet are under his knees. Bring this knee just a little bit closer to the other for me. Good. And so I am going to block a knee. So I usually sandwich one knee. Some people sandwich two knees. I think it's easier to do one. I think it's safer to do one.
Yeah, if you did two together, I mean, that would make it awkward for me to stand.
Right, and so some of your little bit elderly population that has a hard time to push up, or they're really little anyway, their legs are really close together.
Right.
So it's sometimes easier when you have the little 90-year-old, 80-pound lady to sandwich her knees and help her over.
Right.
And again, everybody's a different level of assistance, so she might be,
That'll make her feel safer.
right. So that might be, you know, to some people a moderate assist, but being that she's 90 pounds, it might seem like a min assist to you. I mean, it depends on the level of assist you've been giving and how strong you are. So, anyway, so Alan's to the front of the chair, his feet are flat and slightly back, so they're below his knees. I'm going to have him put his hands on the arms of the chair and lean forward toward me. I'm going to grab around his waist and pull him in nice and close. I'm going to verbalize all of this to Alan before I do it. Alan, we're getting in the chair.
Okay.
Okay?
Okay.
So, I'm going to put my arms around you.
Okay.
Okay, and on 3, you're going to attempt to stand up, pushing with your arms and legs. 1, 2, 3, up he goes. Good. And then we're going to transfer to this chair. So we're going to take small steps. I'm moving 2. I'm not twisting, I'm drop stepping. And go ahead and reach back for your chair, Alan, and sit nice and slow. And then keep him in nice and close. So I didn't have to give him any assistance, but what usually happens is in the middle of your transfer, you've got it all planned out and everything's going well, and you're here, and we come up, and then they're here. So that's, you really want to make sure you're pulling them in close.
Well, interestingly enough, I did lose my balance.
Did you?
Mhm.
I didn't even notice, I'm so used to it.
But you actually guarded me.
Yeah.
And so that was, I say that because you actually prevented me from falling backwards.
And you had your hand on the belt?
Yeah. she
Yeah,
had
so
all of
my
the belt.
hands, I'm sandwiching his knees.
And then we'll go that way. Okay, go ahead. I'll go back. We'll do
Okay.
it one more time.
All right, we'll go back.
Yeah.
Brakes, could you
Yes.
please come apply yourself?
Mhm.
All right,
We'll just do it one more time. to
Yep.
finish.
so we're in
The
nice and
brake lady.
close, 1, 2, 3, up. Good,
See, right now, if she wasn't holding on to me, I would have fell backwards. Or at least potentially could have.
okay, so now I'm gonna drop step, and he's gonna take his little baby steps
I'm
over,
caught on
You
the
gotta hold
chair.
the other chair. You're holding the wrong chair.
and then he's gonna reach back, and he's gonna sit nice and slow.
There's only one set of brakes over there.
Excellent.
So the reason that you're sandwiching his leg too is if that gives way, you can stop it. Again, the awkward positions, if you're used to, you have a walker in the way and he tends to have his leg buckle and so there are a lot of things that are gonna get in the way of a safe transfer every time. But you just do your best. And as long as you have the tools and the strategies, hopefully you can keep yourself safe. So that's basic transfer for bed to chair, chair to bed.
And I hear you saying really clearly, minimize hazard increases the safety.
Yes. Absolutely.
Um,
Okay.
One of the things I have my client do is I often keep saying, lift from your core, lift from your core.
Yeah.
Is there any time when you wouldn't want to instruct that? Is there any time, I mean, it's just good for all of us, isn't it, to constantly lift from the core?
When you're lifting something like off the ground,
From the chair,
Yeah.
just,
so you're really focusing, thank you for saying that, because that was another one of the things that we needed to focus on is that you want to keep a stable core. So a lot of people say, oh, I need to keep my belly tight and I need to use my legs, and then they end up like this. This is not a safe lift, okay? Nor is this a safe lift, okay? And that's how you see everybody doing it in the gym with their butt way out, and it's not safe. So you want to keep a neutral spine, and you want to keep them in close, bend from your legs. So the neutral spine and tight belly, yes. And so with some.
but I mean them too, is, I always say to Larry, lift from your core, lift from your core. And it helps
Yeah.
them quite a bit.
Good, yeah, absolutely. Anything that you can, any way you can cue them. Yep.
As long as we're just talking about the butt for a minute.
Yeah.
Larry and I in Vegas had seen a video on the Africans, all day long they're doing the berries, but they really are sticking their butt out and with the flat back. And I have found Larry's 300 pounds, and so I've been working for quite some time. And I think the reason that I've not had any injury is because I am sticking my butt out more after I saw that. I mean, because I sit like this. I mean, I'm still going down like that if I'm lifting him up and whatnot, but in a lot of the transfers, I am sticking my butt out because I feel like the power is there. And I know we're not taught that in America and whatnot, but can we just kind of talk about that?
I would say working kind of parallel to what you're doing is gonna be important. So yeah, if it's easier for you to, when you're doing the transfer, you're here, you're on, you've got a knee, when you're doing like the bed mobility and the rolling over, you've got a knee and you're over him. It's kind of the same basic concept. I would say the only thing is if you're in this position doing things, it's quite a strain on your hamstring.
Although I'm pretty limber too, so does it just depend on the person maybe?
I think so, but the other thing is if you're lifting here, you're primarily focusing on glute only. I mean, where if you're using here, you've got core, glute, hamstring, quads, calves, all doing the work. So yeah, I mean, if that's how you feel safest doing, you know, whether it's a
I just
bed
find it
bath
to
or
be
something
kind of
like
stressful
that.
to go down like this all the time, whereas that actually feels good for me.
Right. Well, and the other thing
know, 'cause
too, it's gotta be, yeah, whatever, safe for you, but it might be better for you to do something in more of like a lunging position. So if his limbs, you're helping to move just his limbs, and they're pretty heavy, and you've gotta get way down here, a lot of people can't deep squat safely. So in that, you'd go down maybe into, you know, like a split squat, a lunge type position.
That's where I am
And then
in
you
my
can-
care.
Right, and so then you could
I'm on one
do
knee.
this, where you're rotating,
Right.
but not twisting your back.
Okay.
Does that make sense? So you're here, and then it's like a drop step there
Okay,
with a heavy limb.
okay.
So you know, again, it's gonna be, you know your body.
It's tricky,
Yeah.
you hear all these things and,
Yeah.
yeah.
So, great questions though, thank you for those. Are there any other questions about the transferring from bed to wheelchair, or bed to commode, or showers, tubs? It's all the same basic concept. I'm not sure that any of you make equipment recommendations, but you're certainly in a position that you can do that. So please make sure that you're making whoever your supervisors are aware, if someone needs some sort of equipment that they don't have. You know, that's what I hear from a lot of caregivers, or what I've heard from a lot of caregivers over the years. You know, so-and-so, you know, the last in-service I did actually, someone was like, yeah, I almost got hurt the other day because so-and-so now can't even bear any of their own weight. But they haven't been assessed by anyone else besides this particular caregiver for X amount of months, and she felt like, you know, I can still do my job, I don't need someone to tell me how to do my job, but, you know, what if she's not there someday, and someone else needs to help? Or again, the safety of the patient. You know, if it's a slide board or a Hoyer lift or an extended tub bench that will make your client more safe, then make sure you let someone know, because they want to hear it. They'd rather help someone get a piece of assistive equipment or adaptive equipment than pay thousands and thousands of dollars in medical bills. I mean, it's something, what was the number, like 2 billion or something?
2 billion, yeah.
$2 billion a year.
Is what is expended on rehabilitation for injury.
Yeah.
That's workman's comp. Yeah, injured employees. We did, one of the clients that Melissa and Zoraida is working with, the caregivers offered their recommendations to, for example, refitting his shower, because they knew what was needed in the shower. They knew where the bar needed to be put. They knew what the client was capable of doing. And yes, the PT person came in and, you know, kind of verified what they were saying was needed. And all those things got put in place, including the bench. And now he's much safer in the shower than he was before. You know, and that came, like you said, directly from the caregiver's observations. And I've always, as a nurse, felt the caregivers were my eyes and ears anyway. You know, in my hands in many cases for what goes on with clients. So, 'cause if we don't get the information from you in the field, when you're there day after day after day trying to manipulate and deal with the situations in these strange conditions, if we can provide some type of relief from those strange conditions, obviously we want to do that. Because it is going to be to our advantage to protect you, but it's also to the advantage of the client, because it makes the task go much easier for them. They don't have to struggle so hard to be able to make their moves. You know, it's all those things that are important to consider. Anyway, thank you.
Yeah. Something that I didn't touch base on that I thought was important, in the communicating the transfer, just make sure that you maintain eye contact as best you can and really be aware of signs of distress. Because like I said, you know, they start to stand and then all of a sudden they freeze. Or, you know, maybe they have an episode where they go out on you. You need to be aware of what's going on. And, you know, it's easier just to take them here to there, but again, you're gonna be much more safe if you're just really aware of what's going on. One time when I was working at the nursing home, I had a patient go out on me and was walking down the hall, holding on to her, and here we are. I've got her on my leg, I'm slowly lowering her to the floor, and I've got one foot sliding out, and here we're going down. But I had her, she wasn't going to get hurt, nor was I.
You weren't gonna either. because
No,
you were doing it
no,
the
I
proper
didn't,
way.
exactly, but you know, as long as you're aware, those things can happen.
Since you brought that up, I think it's really important to say this, to speak to this. What footwear you have on at the time you're completing these tasks is essential to the safety, your safety, as much as it is to the client. Because if your foot is sliding out from underneath you and you're losing your own balance and your strength is all of a sudden gone because half your body is slid away and the other half is really working hard to hold all the weight, you're suffering. You're not gonna succeed at protecting yourself or that person. So that's why we
We
recommend.
could start a
that we-
shoe company for
Well,
TLC.
yeah, I mean, realistically, you know, we don't want you wearing sandals with no, like,
Yeah, don't wear
like
these
these.
sandals today.
This is an example of what not to wear when you're at work.
Exactly.
Demonstration wise, it's done as vital as it is when you're actually working with that human client, that if he falls or she falls and they break something, and then they end up in rehab for 3 months because you couldn't do anything about it.
Yeah, so sneakers, clogs often.
Yeah.
When I was in the nursing home, I wore clogs every day because it helped my back, but it wasn't safe, especially with the slippery socks on, if you wore those little kid socks.
Yeah.
Oh my goodness, you walk around a corner and you fall off your clog.
Yeah. Or they slide on the floor.
Yeah,
If you're not on a carpeted surface. And in many of the homes you encounter, I'm sure you know, many of them have hardwood floors or they have tile floors, and those aren't necessarily safe with certain types of shoes that are smooth bottoms or anything like that.
yes.
You know, along this line of, slowly bringing somebody down, I was in this situation not too long ago, and this lady's in this wheelchair, and she goes through those spells where she sort of just gets really weak and almost passes out. And so she got that way, and so the person I'm working with says, well, we need to open the window, lower the bed, and, I was kind of saying, well, let's just get her in bed, and which is all good stuff, take the arms off the wheelchair. Meanwhile, she's getting weaker and weaker, and I'm thinking, am I going to have the strength to do this? So I got in front of her and fell on the bed and had her come with me. I was the only,
So you used your entire body weight to move her, is that what you're saying, Sylvia?
I guess.
Yeah. You transferred her in the form of a hug by bringing her whole body with you?
I had to get her there somehow, and
Yeah.
she was really weak, and
But that certainly wasn't a
And it
safe
was
transfer.
just-
That wasn't a safe
it
transfer.
worked.
Well, it worked, but that doesn't mean it was safe for you or for the client. Depending on how you landed, depending on what posture your body was in when you were moving, were you twisted?
Well, that's true.
Yeah, were you
That's
twisted?
true, but she's getting so heavy.
Yeah.
And it was just you and her there?
Yeah.
The other girl was there, and she she wasn't doing it. She was behind. Maybe she gave me a push. Gave the lady a push. I don't remember, but
Were there two of you caregivers present?
yeah.
Well, I guess I have difficulty understanding why you ended up doing the transfer alone.
Because she was kind of not. I was
She
I was
wasn't
the braver
participating?
of the two.
Okay, so you didn't have cooperation from the other person?
I knew I had to do something.
So maybe a review of a two-person transfer is a good idea for right now.
I think that is a good idea.
So,
She was very weak.
Yeah.
so there are a couple of options. If she were to have passed out in the chair, there's always the fireman lift.
Yeah.
It's not, it depends on how high the wheelchair is, whether it's safe or not, or the most safe way it could be.
Or how far you gotta go with them.
Exactly. So, ideally, you're pulling it up as close as you can to the bed. In that instance, you might have her upside down in bed because you may not, may not safely be able to back the chair in and have one person in back of her and be able to get her in bed that way. But, you know, in that instance, you're working on one person, if it is a fireman lift, that's one person behind, and this is something that they teach you typically in nursing schools and such, and so you're around here. You're in nice and tight and you're holding here, and then the other person has underneath the
Just
legs.
the legs, yeah.
Same idea, hugging
Yeah.
around.
Yeah.
And so then it's a 1-2 heave ho up and over. Oftentimes, if she has removable armrests, it's gonna be a little bit safer. Slightly awkward for the person on the back, but then they can be more here and kind of assist here, or even grab the pants and pull that direction. So if it were a two-person assistant and I were there, I would say one person doing the same transfer we just did to this chair, right up in front, pulling her in. This other person in the back,
Helping to stand.
helping, again, gate belts behind, lifting and transferring
I
and
think,
such.
yeah, part of it was she had back issues,
Yeah,
and I had back issues, and I figure, you just
yeah.
gotta get her there.
Sometimes you gotta do what you gotta do. I
Right.
mean, that's,
Yeah.
I've been in that
It's true,
situation.
yeah, I mean, it isn't that you did anything wrong, it's just, I think it's important to always analyze, is there another way that I can do this
We could have
safely?
twisted.
Right, I mean, if you determine that the only way was to do what you did, then you did what you had to do, and you did it, and it succeeded. But there's always alternatives as a rule for those types of situations, and you should look and analyze every one of them before you make a final decision. You could have maybe insisted a little stronger, for example, that the other person who was with you participate somehow, even if it was doing nothing more than lifting the person's legs, okay? Or, like Gina was saying, you please get behind the person and help me, I'm gonna pull them up, I need you to push them.
I think she did, I don't
Okay, but
remember.
however it plays out, I'm just giving you examples, Sylvia, of what you could have looked at to prevent you from being the only person involved in doing it. So that there is a lesser risk of you hurting yourself or hurting your client.
And if this is something that in fact happens often, well, then it's good that you brought it up, because then,
Absolutely.
you know, even just having a slide board in the corner, it's gonna be easier to slide them over.
Right. And that could be easily purchased by their family and kept right in the home, so if you ever are in that situation again, or even in a nursing home, most nursing homes have slide boards as a standard equipment.
What about for Larry? I don't know.
Well, you mean for a slide board for
I'm
her?
thinking about that.
Why not? They make slide boards for
He's heavy, is that-
heavyweight
300.
people.
How much?
300.
Yeah.
Oh, they have bariatric
Yeah,
slide
they
boards.
have bariatric slide boards, and they're well-designed, they're smooth. As Gina said, they're designed to
I don't
literally
like slide boards.
be a bridge from a bed to a chair or back, or the other direction. And the person just scoots across, I mean, it's not, they can actually help you, they can use their own body to help you move.
And if they can't,
Right.
same concepts apply. They lean forward. No one wants to lean forward on a slide board. They always feel like they're gonna fall off,
Right.
which is not the
Right.
case. You wanna keep their weight forward so it's over their rear end, so that they can
They can
slide
slide,
across the
that's why it's
board.
called a slide board.
Yeah, and if they can't assist, it's easy to pull them over.
Right.
Belt.
Yep,
Right,
yep.
because the surface is polyurethane to the point where it's as smooth as, almost as smooth as glass. It would be as smooth as this surface here, for example. So, not much is gonna be dragging on that.
So he's got a water bed with that,
Yeah.
I've just never
Oh,
used a
dear.
slide board before with that.
On a waterbed?
Yeah,
Yeah.
well, it depends, again.
That wouldn't work, right?
There's a frame on the bed.
There is a frame.
There's a wooden frame.
Yeah.
More than likely, you wouldn't be able to get him up above high enough on the transfer board
To get them onto it
to get
now.
him onto it and out of it.
Right.
How do you get them up now?
He's got a grab bar and then
Yeah.
lifts and then I assist with the lift.
He has a post bar
So
next to his bed.
as things progress with him, he might be a candidate for something like the trapeze. If he's still strong enough to assist, if he has the trapeze over his bed, he could kind of lift a little bit of his own weight up
Right.
to help to
Would
the
you
edge
do
of the
that,
bed.
Larry, good?
You could probably consider that and recommend it.
Because then again, it's not so much work for everyone else.
It might be something that can be even accommodated to that pole that he has next to his bed, to the pole that he
Yeah.
has next to his bed. That would be, like an extension out from it. I can't remember exactly how it's designed, it's been a while since I've seen it. That's a really good example of where.
So we can just get online and look at
Yeah, but the thing is, again, if it's,
It's gotta be properly installed.
yeah, and
Yeah.
it's gotta be a bariatric,
Right.
meaning
everything.
bariatric means.
So
Heavy.
bariatric means
Heavy.
over a certain weight. So certain medical equipment has certain weight restrictions.
Right.
And so maybe a regular trapeze goes up to 200 pounds
Right.
or 250. It depends. Some people say 300 plus is bariatric, but some equipment is only to 250. And so you would just have to look at that and see. And then you wouldn't want someone to just throw in like a wooden dowel across and hook it to that and say, oh, the
Right,
trapeze
right.
is bariatric, but that dowel isn't. So you wanna make sure there's a solid bed frame. If he's got a hospital bed, they often have the frame that can come up around, and then the trapeze hooks to that, and then the trapeze then would be adjustable. And so if he needed it to scoot up in bed, or if he needed it more to pull himself forward to be able to sit up, it's something that he could use.
They also make a ceiling mounted track guided Hoyer lift,
They do.
which also can be used for very heavy people who are incapacitated in terms of mobility.
I'm
And
surprised
they
he
have
still
them that
has a
can help
water
them
bed at
walk.
that weight.
Oh, they do now?
Yeah, they unweight them, it's the
Really?
same thing, it's the same system, you can assist them.
It's
along
two of
with
them, it's a husband and wife team.
But still, I mean, we were having back trouble and the doctor says, get rid of that water bed.
Really?
Yeah, it's a whole host of things there.
Anyway, that's a very good example of where you're trying to analyze what's gonna be the most effective thing, and also meet the needs of the client and the satisfaction of the client, because maybe he really likes that water bed and he doesn't wanna have to get out of it. But the day may come when he won't be able to sleep in that water bed anymore, because he won't be able to get in and out of it. Well,
But
getting
like she
in's
said,
easy,
you know,
you
they
just
don't really
fall in.
necessarily recommend it, but
Right.
he thinks it's giving him relief, but.
No,
Oh, the
and it
heat.
might be, it
You
might
know,
be,
the
there's
heat
heat
could be-
there,
yeah.
and there's
heat.
the water, the buoyancy of the water, it could very well give him some relief. Doesn't have any pressure points when he's sleeping on that bed.
Right.
You know, there's no factors there. So there's a lot of pros to having a waterbed, but the most complicated thing about a waterbed is getting out of it.
Yeah.
Sure.
Even for a normal person with no handicap. I know, because I used to have one.